Welcome to Nutritional Rehabilitation for low back pain in older recreational golfers. How common is low back pain? Well, 26 million people play at least one round of golf every year in the U.S., and low back pain is reported by about 15 to 35% of amateur golfers. Okay, so significant low back pain going on out there. We do know that the risk of this pain increases with increased age, increased BMI, and if you're carrying your clubs. Okay, swing mechanics and limited range of motion may also contribute, but that data is not conclusive. What's a golfer to do? We want to employ evidence-based strategies for rehabilitation and prevention. Proper balanced nutrition can actually reduce the risk of injury through helping you maintain a healthy BMI and low inflammation in the body. You can also use the common sense strategy of not carrying your bag, using a push cart, getting a caddy, or using a golf cart. What about after the injury occurs, right? We use nutritional strategies to augment traditional treatments. So low back pain injuries typically result in some form of acute inflammation, and then that requires immobilization and time away from the sport. So the major concern is that the immobilization will lead to sarcopenia or muscle atrophy. This is already a concern as we age, so it's definitely something that we want to address in an injury situation. All right, caloric needs after injury. Adequate calories are necessary. There are increased demands, energy demands for injury healing. So a negative energy balance can actually slow the healing process and lead to muscle loss. All right, so you want to consume 25 to 30 calories per kilogram of body weight to aid in the healing process and prevent the loss of lean body mass. So for example, an 180 pound golfer, that would be around 2,000 to 2,400 calories per day. Macronutrient considerations. Let's break it down. So protein. Adequate protein intake is essential. Protein provides amino acids, which are the building blocks of muscle. All right, so we want to aim for 1.6 to 2.0 grams per kilogram body weight per day, spread out over your day. So that's going to look like 20 to 30 grams of high quality protein every 3 to 4 hours. All right, so examples of high quality proteins: chicken breast, lean grass-fed beef, ground turkey, fish, egg whites, whey protein. You may also consider 30 to 40 grams of casein protein at bed to increase overnight muscle protein synthesis. Carbohydrates. So the role of carbohydrates in injury recovery, it's not as clear as that of protein. But the research does show that adequate carbohydrate intake can have a protein sparing effect. Okay, so we want to make sure we're taking in enough. And try to stick to complex carbs to avoid weight gain. This is not a free ticket to eat cupcakes, but you can have really nutritious complex carbs like sweet potato, beans, brown rice, quinoa, oats, the good stuff. All right, fats. What about fats? Eating sufficient healthy fats may help relieve inflammation due to injury, right? And then additionally, supplementing with 4 grams of omega-3s from fish oil has been shown to increase anabolic sensitivity. That basically increases your ability to synthesize muscle in the presence of amino acids. All right, so healthy dietary sources of fat include olive oil, avocado, fish, nuts, etc. What about micronutrients? They perform a lot of physiological or aid in a lot of physiological functions in the body. So we want to avoid micronutrient deficiency, especially after injury when the body has increased metabolic demands. Okay, so we consume a variety of fruits and vegetables to provide antioxidants as well as micronutrients. And you may also consider supplementing with a high quality multivitamin. All right, so let's recap it. Nutritional strategies can augment traditional therapies for low back pain in golfers. You want to consume adequate calories with an emphasis on protein intake spread out over the day. Include complex carbohydrates, a variety of fruits and vegetables, and plenty of healthy dietary fats. Also consider supplementing with omega-3s and a multivitamin to reduce inflammation and avoid micronutrient deficiencies. Okay, that'll cover the bases and have you well on your way to recovery. Thanks, guys.